Welcome everyone to our monthly The Doctors Are In. This is our community virtual health clinic. This is sponsored by It Takes a Village Ministry, and this is part of our sharing with the community, and we are here to serve you. I'm going to do a brief introduction of myself and Dr. Kelly Sutton, and also Dr. Alejandra Huante. And first and foremost, I am so honored to be able to share this panel with these phenomenal medical doctors because they are just awesome in their own right. Dr. Kelly Sutton has been serving our community, especially our young children, you know, little babies and all the years up. And she was working previously in California. And I learned a lot more about her when she was over in California. And now she is shifted over to Rhode Island. And we also have with us Dr. Alejandra Huante, who is in Mexico. So we are definitely honored to have her. And she is also a homeopath by trade, in addition to serving as a physician. And my name is Dr. Michelle Gamble. I am not a medical doctor. I am a doctor of nature's cures, a naturopath. And so what I focus on is helping people in their journey to heal in non-medical ways, meaning not using any kind of medical prescriptions and things of that nature. In any case, we welcome you to our wonderful virtual health clinic, and we invite you to ask any questions that you may have pertaining to any health issues that is of interest to you. So there are a variety of ways that you may do so. Either you can put your question into the chat box, or you can unmute yourself and go ahead and ask us in person. So I'm going to open up the forum for everyone to jump in, ask any questions, or even if it's just to put forth a concern that you would like us to discuss and address as a community.
Michelle, Dr. Gamble.
Yes, ma'am.
This is Lori Zern. I talked to you recently.
Yes.
In California.
Yes.
And I have a question. We have some parents whose children are in special education, and therefore they are being prescribed pharmaceutical drugs. And one woman in particular, this is in Lancaster, California, she does not want her child drugged. And my question is, my thought was if she could hook up with one of the doctors who is, integrative, holistic doctor who does not use pharmaceutical drugs, but could use amino acids or all the various other opportunities for non-pharmaceutical interventions. Do you have experience with that as parents? I'm just very interested.
Okay. So I'm going to put that to the panel first and foremost. I know especially Dr. Kelly Sutton, who can definitely relate, having had experience dealing with parents in that particular neck of the woods.
Fantastic.
Dr. Sutton?
So the type of special education might be key in deciding what kind of doctor you want, because some children who have autism or developmental delay or mitochondrial dysfunction, there's a group of doctors who dived very deeply into that biochemistry, and they really understand the amino acids better than a lot of others. Where is Lancaster?
It is about an hour and a half outside of Los Angeles. And it has 52% Hispanic community, about 18% Black, and then some white and other ethnics.
One doctor I know in Southern California who works with special needs is Rachel West, and she's a DO and very experienced.
Okay.
The other thing you could do is check with physicians for informed consent. The
Physicians.
PIC.
Okay. Perfect.
Mhm.
Okay, because I want to help some of these parents. I don't see why parents should not have some kind of choice. Otherwise, they feel like they're being forced to, to drug their child, and they don't want to
So
do
the
that.
schools cannot prescribe. There must be a doctor involved to give a prescription.
Okay.
So it doesn't quite hang together if the school is making this happen. But I think
I believe it's just a matter of that they have certain doctors that are somehow connected into the system who just regularly prescribe pharmaceuticals.
okay. And who chooses the doctor for the child? The parent usually. Is the school telling the family they have to go to a certain doctor?
I don't know that specifically. Again, I think they're just being given sort of the doctors that are connected. And that was one of my questions is, shouldn't the parent have a choice of, of what doctor they would utilize?
Yes, I agree.
Okay. Okay, fantastic. I really appreciate it.
And I can come at this from a variety of different perspectives. Number one, as a parent, and number two, as a teacher in the school system, and number three, now as a natural health care provider. And I will tell you from the perspective of the teacher, they will have a situation where they will force parents to put their children on various medications with the threat that if you don't do this, you will not be able to have your child attend school. And I've known several parents that have had to deal with that particular issue. Is it legal? No, but many parents get intimidated when school officials come down with that particular vantage point. I work very closely with children who have autism and who have ADD, ADHD, but when you are dealing with a school system such as this, you do want to get someone who has a medical credential, because that is the only thing that will stand up in court. And sometimes these school systems will call in social services, and the social services will come in and they can literally take your child away from you by saying that you are being medically negligent,
Yeah.
and all kinds of things they'll make up. So it's very important to have a medical doctor on file who is treating this child, so that you have records and you have that credential. Another resource you can look into is the Walsh Research Institute, WRI, and they have a list
I'm familiar with them.
Yeah, so they have a list of practitioners that may be in your area. And then the other thing that I've done with some of my clients is that I've worked with their pediatricians or their doctors, teaching them about the various testings that we do. So, when we do things like the oat test, the organic acid test, looking at amino acids, or when we do comprehensive stool samples, I will actually sit there explaining to their medical doctors why we were doing that test, what the results are showing, why it's indicative of putting in certain supplements, and also changing dietary things of that nature, so that we start to grow our family. A lot of times we look for people who are already in that boat, and we pass up opportunities to teach our medical providers, because I truly believe that there are a lot of medical providers out there that are willing to expand and willing to grow and really have the interest of their patients as their priority. They just don't know what else to do because they were never trained in this way. And so rather than giving up on them, to give them an opportunity to learn and to use that situation with you or your child to be able to become another person who's part of the family. Dr. Huante, anything?
Totally makes sense.
Well, with homeopathy, Dr. you could also treat child with special needs and education, depending on each case and the symptoms each child has, but you can treat with homeopathy and have like milder symptoms. And also with energy medicine, you could look out for a practitioner on energy medicine, and it helps a lot on the development of the child. So I would also tell you that.
Yeah.
Thank you
that's
very much.
very, very
Dr.
true.
Campbell?
Yes, sir.
Yeah, this is Reverend Fred Shaw out of Inglewood, California. I'm the president of the NAACP out here, and I'm also a member of the Citizens Commission on Human Rights. I'm actually on one of their executive board. And the thing is that in 2003, a federal law was passed. I was part of it. I got the NAACP involved in stuff that prohibited parents being forced to put their kids on drugs as a condition for being in school. And that was signed by George Bush. And so it became federal law. So if they're doing that, unless some law has been introduced to rescind that, then they are in violation of federal law.
Oh, thank you so much for reminding us of that, because again, that is why it's important for us to come together as community to pull forward all of these different resources that we have as each other and people who remember different things that have been passed and legislation that has been passed. Because unfortunately, a lot of our agencies, educational agencies, medical agencies, and things of that nature, they thrive on intimidation. They don't necessarily
Yes.
have the law on their side, but they thrive on intimidation, and they thrive on many parents not knowing their rights, many people not knowing their rights. And so that is how they can get over on us. So thank you so much for reminding us about that, Pastor Shaw. All right, so what's our next question? Let's see, we have here a question in the chat. Are there herbs to help type 2 diabetes, lose weight, and do you need a counselor to use them? Most long videos require that you pay for supplements. Okay, I'll put that to the community. Dr. Sutton, Dr. Huante, Dr. Laing. Yay, it's Dr. Laing. We haven't seen you in a little while. Woohoo! And he's going to talk to us about a question that came in specifically for him. So anybody wants to tackle the diabetes question? I'm going to say Swante. Dr. Sutton.
Here we go, together. I know rosemary is a wonderful herb that helps with blood sugar, and berberine, and in anthroposophic medicine, we use a low potency homeopathic phosphorus 6X. The rosemary is used as an oil in baths, because when you shake the oil and put it under the running tap, put it into the water with some big figure eights and then soak, it really penetrates through the skin and has this improvement of circulation and lowering of blood sugar. So those are the two main herbs that I think of. But you hear a lot also about some simple things like cinnamon that helps lower blood sugar. And I'm sure there's others that other people will know.
Dr. Huante?
Well, as I always tell you, in homeopathy, it's important to see the symptoms that every patient has. So depending on that, they will have a different treatment. If they have, I don't know, if they are having fogginess and they can't think right and they don't have energy, so that would be one treatment. Or if they have like a lot of energy, that would be another treatment. So depending on the symptoms of each patient, that will be the treatment. And talking about plants, here in Mexico, the cactus, you juice it and you drink it, and it helps a lot to lower the sugar in your blood. So I don't know if you have ever tasted the cactus. I like it because I live here, but it's like slimy, but you can add lemon and grapefruit and celery and a lot of things to this green juice, and you drink it every morning, and it helps a lot to lower the sugar in your blood.
Yeah. For me, when I work with people who are diabetic, What I'll tell you is that if I have 5 different clients who are diabetic, it'll be 5 different issues, 5 different recommendations, because basically what I do is I look for the root cause. So there are a variety of reasons why someone's blood glucose may go up. For some people, it's because they don't get enough sleep, believe it or not. And so I have to go into different herbs or foods and lifestyle changes that will help them to get better sleep. For other people, it's because they've developed what's called insulin resistance. And so then we have to start working with training the body to recognize the insulin, number one, and that may be because of certain deficiencies in certain nutrients such as chromium, you know. And then there are other people who are having elevated blood glucose because they're just eating crap. So, you know, you can take all the berberine you want and all the cinnamon you want and all the cactus juice you want, but really and truly it's because you have to start changing your diet. For other people, it's because they're having difficulties properly utilizing the fats in their diet. They have a tendency more towards the sugar metabolism or the Krebs cycle, you know. And so we have to look at supporting the body's ability to better utilize their fats and therefore lessen their dependency on the blood glucose elevation. So it really just depends on each person and finding out what the root cause is, as opposed to just slapping a Band-Aid on there to force the body to reduce the blood glucose in the blood. Because to me, if I did that, I would be no better than a doctor, you know, recommending metformin or Invocano or whatever, you know, interesting remedy that they have, because then you're not dealing with the underlying issue, and it'll always come back to bite you in the butt, because as you force one thing to go down, the body will compensate and put something else off balance. So that's just something to consider. Okay, well, I hope that helped. And now we're going to turn the tide over to Dr. Laing. Are you there, Dr. Laing? Dr. Laing.
I had to unmute myself. Can you hear me?
Yay, because I remember you had a special question that came
Yeah.
in, a question came in just for you. If you could share what that question was and the response to it.
I'm gonna have to pull it up again from my email.
Okay.
Give
So
me just a moment.
If I remember correctly, it was someone who had a concern about COVID and about the safety of going into the dentist's office with regards to protocols. Am I right? Or is it something of that nature?
Okay. Yes, that was one of them. I think you sent me maybe 1 or 2.
Yeah. Mm-hmm.
But let's deal with that one. Surprisingly, I wouldn't say that your exposure is any more high than just in the community, okay, just generally speaking. The mouth, and when we're treating patients, there are a lot of aerosols that are created. And as we know, at least from the news and things like that, we've become being transmitted, or it's transmitted by droplet.
We're having a little bit of difficulty hearing you, Dr. Laing. You're kind of going in and out.
Okay. Give me just a second.
Okay.
Can you hear me now?
Yes, we can. Uh-oh, it's breaking up on us again.
Give me just a second.
Okay. So as he gets situated, I know, interestingly enough, I did go to the dentist during all of the COVID interesting craziness. And I had spoken with my dentist, and he said, ironically, dentists are probably some of the most hygienic medical practitioners ever, because even before COVID, they work in very sterile environments. They're used to all of this stuff because the mouth has a lot of bacteria and things of that nature. So your dentist is probably one of the safest medical doctors for you to go to, ironically. But that's just my 2 cents, Dr. Laing.
Can you hear me?
Yes.
Can you hear me now?
Yes.
So what I was saying is that we know that this infection is by droplet. And so, you know, at least I think the increase of exposure to maybe just, you know, those who may be being treated or those who are, you know, possibly accompanying somebody who's being, okay, the hand pieces that are kicking up water in the mouth are creating aerosols. You know, the suction get all of what's being kicked up. And so what we've been doing is using extraoral suction. So it's basically like an atmospheric suction system. So we have the suction in the mouth, in addition to all of the sterilization techniques that we've been, like you said, we've always been using. And then we have that extraoral suction. So whatever's being kicked up in the air, especially around the head of the patient, is being sucked up into that system, in addition to the intraoral suction that we're all used to. So I really don't see any increased risk to the patient being treated in the dental office, because like you said, we've been doing this for a very long time.
And do you remember what the second question was, Dr. Laing? Okay, I think he's faded off on us again. So any other questions, ladies and gents? We are here to serve you. Any questions that you'd like to put forward? Well, I had another question that came in from someone in the audience. And the question was pertaining, as you know, this is quote unquote Breast Cancer Awareness Month and all that interesting hoorah with the pink ribbons and things of that nature. And so the concern was a question regarding, she was told that an ultrasound would not detect calcium deposits in the breast, because they were trying to encourage her to do a mammography. And she said that she didn't want to do the mammogram. And so they were like, well, that's the only way for us to detect whether or not there are calcium deposits or cysts in the breast. So I was going to put that to the panel here.
Of course, an ultrasound can detect calcium deposits and cysts. So I am a big fan of the mammogram. So I would tell this patient to do an ultrasound. And if they find anything suspicious, maybe a second step would be to do the mammogram. But of course, the ultrasound can detect those. So she can do it with comfort and security.
Well, that was my thought also, you know, but like I said, I will defer to the medical doctors on this one. So Dr. Sutton.
Definitely, the ultrasound is the way to do the definition of a cyst better than a mammogram even. I think the mammogram does look at different types of calcium deposits. And so you can see if they're spicules or round clusters or not, maybe in a more accurate way than the ultrasound does. But the question is, does she have dense breast tissue? Because if the tissue in the breast is very dense, then the mammogram doesn't see anything. And it's kind of a waste of radiation. And usually when a mammogram is read, they will say the mammogram shows blah, 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 but the breast tissue is dense. And so we can't really say that this is all there is. And sometimes people, if they really, really, really need breast imaging for someone with dense breast tissue, they'll use an MRI.
And one of the other things that I suggested to this particular person, and I'm suggesting to all of us as women on this call, and for those of you who are men, for you to share with the women in your life, is for us to consider thermography, you know, as an alternative to mammograms. So mammograms expose us to unnecessary radiation. And actually, there's a lot of research that has been generated that shows that it actually increases your risk of various cancers because of the increased exposures. Whereas thermography does not expose you to radiation, and it gives you a heat imaging of the breast. In fact, you can get a thermography session done for the entire body to identify various quote unquote heat pockets. And the thinking behind it is that if you have a cancerous area in the body, it will generate a lot more heat because of its proliferation than the other normal areas of the body. So that is another alternative that I encourage people to research and to consider as they are looking at preventative measures for themselves. And I saw Dr. Sutton and Dr. Huante shaking their heads. So if there's anything else you could add, please do. Okay.
I think all the different imagings have an advantage. It's like they can see a different thing. And very rarely there will be a person who has a cancer, but it shows up only on one kind of thing. And so you do, if you have a real concern, have to do more than one imaging type. The peak incidence for breast cancer is around age 50. And that's when it probably matters the most, because the premenopausal breast cancers are more aggressive, whereas the postmenopausal breast cancers are kind of lazy. And so if there's any time in your life that you want to be thorough, maybe go ahead with the mammogram around age 50 is a good time to do that.
That's good to know. Thank you, Dr. Sutton. We have a question that came in regarding vertigo. If anybody would like to address that particular concern, vertigo.
Well, first we have to check why is that person having vertigo. It could be because of muscles, of tension in the muscles of the neck. It could be because of an ear infection. It could be, I don't know, a tumor or another thing. So first we have to see why is that person having vertigo, and then treat that root or that cause, not just treat the vertigo like that. So we have to look like the comprehensive treatment for the patient, not just one symptom.
Okay, I think she wants to jump in. She wants to jump in and explain a little bit more about what she means by vertigo. Go for it, girlfriend.
Hello. Hi, everybody. I'm Wylena, and I'm in Las Vegas. And I just recently got out of the hospital. I was in Florida with my daughter. And but before I went to Florida with my daughter, I had this terrible, terrible attack. And well, it was my blood pressure, it was vertigo, I had a headache, and my head was spinning. I couldn't even hardly stand up, and it was just horrible. So I ended up going to the hospital. My blood pressure was extremely high. It was 239 over 126. And so they was trying to get my blood pressure down, They gave me some type of injection in an IV, and they gave me pills, and initially it wouldn't come down, and then finally it came down, and then it went right back up again. And so then they had to give me more pills and another injection. And so after that, it stayed down, but I was still off balance, and I was still, you know, my gait was off, and I was stumbling and wobbling. And so they did an MRI, they did a CT scan, they did an EKG, they did a echocardiogram, they did a what's the one? Is this the echocardiogram, the one in your neck? Okay, the one in your neck, is that the echocardiogram where they do the ultrasound on your the one where they check the carotid arteries? They did the echocardiogram, they did the carotid arteries, and they did the CT scan, they did an MRI. And so what they came back with was that they said I had high blood pressure. They said I have BPPV, and I also have arthritis in my neck. Well, I've been in 5 car accidents and I've had 5 whiplashes.
Wow.
So it stands to reason that I got the worst neck on planet Earth. So I always wake up every single day. I don't care what day it is. I always wake up with neck pain. And I've been having neck pain for years. And because of all these accidents, I guess, but every single day I have neck pain, every day. I never wake up without pain in my neck. Right now I'm sitting here and I got pain in the back of my neck. And so they said that I had a C4, C5 something here, and pinched nerve or something. And I'm wondering even if, because I was going to ask about my hands too, because this right hand goes numb every night. And I wake up not hardly able to use his hand. So I don't know if it's related or what, but either way, the vertigo is the part that bothers me the most because, you know, if I bend over, I stand up and I'm, you know, it takes a minute for me to get it together. If I lean this way or if I lean that way, if I turn my head one way or the other, you know, so I'm dealing with this messed up head. I'm messed up in the head, okay? So
aren't we all? We're all touching to some degree.
In the head.
Okay, so I'm gonna ask Dr. Sutton to jump in. She has some stuff to say.
There are exercises for that BPV that are pretty effective. Did they give you those?
They told me about the exercise where I'm supposed to, but I have a difficulty doing it by myself.
Yeah.
Because, you know, I'm supposed to turn my head a certain way. Yeah. And then another way. And when I do that, everything just go crazy. And I feel like I'm just gonna fall all over the place. So I'm afraid to really do the exercise alone. And I live alone.
Right.
So, you know.
Could they do a PT referral for you so you go for physical therapy and do the exercises at the PT place?
Well, the doctor did mention they supposedly gave me a little bit of physical therapy when I was in the hospital. And he did mention something about, you know, me. My daughter set me up when I was in Florida, which was just absolutely marvelous. She set me up for a massage therapy. I was laying there enjoying that. Of course, I still have the vertigo, but it's not nearly as bad as it was. I mean, I'm able to walk around and do my thing, but just periodically, and I'm afraid of it because I'm actually a singer too. And so I'm afraid that if I go somewhere and sing and maybe I turn my head the wrong way or something, I might lose my balance, I might fall, so this is really bothering me.
So you probably need a course of treatment that includes massage once a week and physical therapy once a week with those exercises.
Okay.
And then tiny little bits of stuff every day at home, but not very much at home, because you don't want to trigger something that you can't handle. But some little bits will get you to be able to regain your confidence that you can go out and do things and not have a big attack. Because like you say, the little things are not too bad, but it's when it's overwhelming that it really interferes.
Yeah. And another thing
I'm consider that the blood pressure played a role. Because my blood pressure was sky high. And so I guess with all of those, they said I have arthritis in my neck. So I don't know, and they were talking about surgery possibly in the long run or something. I'm not getting ready to do that. I don't let nobody cut me. If you don't cut me in a fight, you're not going to cut me in the hospital.
That puts a perspective on it.
So have you ever been to a chiropractor?
No, I have with those car accidents and stuff, all back in the day, when I was each car accident, chiropractor. But the doctor this time, when I was in the hospital, because my daughter asked him, should my mom go see a chiropractor? He said no, because he said that would be too aggressive. He did agree to the massage therapy, but he said no to the chiropractor. He said my neck was in too bad of a shape. He felt like, I guess the chiropractor might be too aggressive on my situation. I don't know.
Well, all chiropractors are not the same.
Right.
Dr. Sutton, you were going to say?
The Nuka chiropractic is the upper cervical, and they're very gentle. And I'm not an expert, but Michelle is right. You have to kind of interview the chiropractor. I think the medical doctors will always say chiropractors are bad because it's just a standard thing to say nothing works except conventional medicine. So do your own investigation and call a chiropractor's office that you've heard good things about and say, have you worked with people who have a very bad neck arthritis? And what is your method? Because I think it's called thrust, isn't it? When it's the really quick, hard moves. And then there's other things that are very gentle chiropractic.
And then the other thing that came to mind for me is that we don't really think about this often, but when you are involved in a car accident or playing contact sports or things of that nature, sometimes you may suffer from brain damage because the brain is being shaken, and it's just this really soft, spongy tissue, and that would impact different areas of the brain. So another thing to consider is to go to somewhere like the Amen Clinic, and there are a couple of different Amen clinics. I know there's one in Atlanta, Georgia. There's also the Amen clinics over in California, in New York, and things of that nature, where you can go to have a SPECT scan, SPECT scan done. And that would help to identify if there has been actual damage to the physical brain, because that also can lead to vertigo, when you have certain damages in certain areas of the brain. So it's very important to consider all possibilities, not just the fact that you have that restriction and possibly pinched nerve within the C vertebra, but also the fact that there may actually be specific brain damage due to the several accidents that you have been. So you could have had like little mini concussions and things of that nature that have actually, squished different parts of the brain or eroded different parts of the brain and things of that nature. Dr. Sutton?
Okay. Well, they did say that the CT scan and the MRI said it was nothing going on up there. There was nothing up there.
This is a different type of scan. So it's not the same as an MRI. So it picks up on electrical patterns within the brain to see if there is an overactivity in certain parts of the brain or a diminishment of activity in the various parts of the brain. So it's like Dr. Sutton said, every scan does something different and has its pros and its cons, and it has its limitations. So this is a very different type of scan from an MRI.
Okay. Thank
One
you.
of the very
Dr. Sutton?
No, Kelly.
One of the very best pain relief methods I've seen is called Symmetry for Health. And it's just thatname.com. And it was started in California by a man named Patrick Mummy, who was an athlete. And he has since treated a whole bunch of athletes. And he measures the person's orientation in space, vertically, horizontally, and frontally, and then gives you exercises to get things back in alignment. And that best alignment could take the pressure off of these discs and arthritis in the neck that don't want to work right. But it means doing the exercises twice a day at home. They aren't the same exercises, so I don't think they would stimulate the vertigo, but it may help relieve your pain. And everything probably is working together to make things worse. And it's all centered in this upper area to give problems.
Okay, so, and I'm not gonna take up all the time, but I wanted to go back to what I said about my hand and my, my numbness. With that, do you guys know if they are connected in any way? Because I wake up with this hand numb in the mornings. This hand is like numb. And then this particular finger right here, this finger locks. It just locks up, and then it locks like that. And then when I try to open it, it pops open. And I'm like, what the heck? And this just recently started, maybe, about 3 months or so ago,
So that's
but
why
it's crazy.
That's why we were suggesting a chiropractor. There are chiropractors who are very well versed in the various C vertebra and specifically which nerves relate to the hand and specifically which finger, and it is an art and it's a science all in one. And so I encourage you to do as Dr. Sutton was saying, which is to interview various chiropractors and ask them about what they do with that particular type of injury, and tell them what your concerns are and see how they respond, and then go with your spirit. Dr. Huante, what were you thinking?
Oh, yeah, you should ask the chiropractor, because yes, of course it's related, because you might have a nerve compression and that it's affecting your arm and your hand and your finger. So you need to decompress that nerve. And while you work on that, on your neck and that, you could take a homeopathic remedy called tabacum for your vertigo, okay? You can have 5 pills every morning for 10 days, tabacum. I'll write it down in the chat.
Oh.
So that will help you out with the vertigo while you solve the neck problems, okay? Because I think the root of the vertigo, it's in your neck.
Okay, let me ask you something, Dr. Ali?
Alejandro Huante.
Dr. Okay,
Huante.
the doctor that, okay. The doctor that was just talking.
No
Were you on, I want to know, Dr. Gamble, was she on when I was on with you guys before, a couple months ago, maybe?
Probably.
Because you had a doctor on that gave me a homeopathic something to take, and I forgot what she gave it to me for, but I went, and then I was standing there and I was reading all these names and stuff, and so I found another one that helped me with my indigestion, and I have them here. And I use their little bitty beads, and I take those little 5 beads at night. And if I tell you, I sleep so good, and I don't get that indigestion that, because I was waking up in the middle of the night with the worst indigestion there is. And because of, and I believe it was her, I'm not sure, but because I tuned in, and whatever question I asked, she told me to go get, and it was something that she told me to get, and I probably have it over there. But I know the one that I got, and I've passed those places, those little shelves with all those little tubes. I've passed them a million times, and I often wonder, what is that? So because of her, I went ahead and dove into it, and I picked up several, and it might have been for sneezing or something. I don't remember what it was for, but I just want to say thank you to her. And if it was you, Miss Aliante, whatever, however, I just want to say thank you.
Well, I don't know if it was me, but it's a pleasure that homeopathy has been serving you.
Yay. Wonderful.
Okay, so
wonderful.
now you're putting the one in, okay, there it is. Tab.com.
There you go. All righty. Okay, any other questions? Come on, people in the chat. What are some concerns? Anything that you are dealing with currently that you would like us to address? So everybody's so quiet. You guys must be like the healthiest people I've ever known. No issues.
My daughter was trying to figure out if it was too late to log on, so I don't know if she's gonna make it.
She can go ahead and log on. So now we had a person that I was speaking with. Sorry for the background noise there, but they were concerned about, they had COVID, and now they're dealing with an issue of their smell. Their smell is not as attuned as it used to be. So I wanted to put that towards the group. If you have any thoughts of how this person could proceed.
Michelle, can that person get a blood test for zinc?
Yes, that person can get a blood test for zinc.
That would be my first thought, because zinc is related to smell and taste both. And lots of times we're deficient in it. It's pretty easy to be deficient. And we know that it's by zinc getting inside the cells that COVID gets better. So if that person had a borderline reserve of zinc and then it all got used up fighting COVID, it's not back to normal for the other functions. If that's the only thing they've got, they aren't really a long hauler COVID. But if they had loss of smell plus, then I know the frontline doctors have put out a program for long haul syndrome. And I haven't read everything about it yet, but it goes into ivermectin and corticosteroids and some antihistamines. But I think the zinc is the first place to look.
So that protocol, is it on the America's Frontline Doctors website, or is it on the FLCCC website?
FLCCC.
Okay, so that is the website that I encourage all of you to visit, because it has several different protocols pertaining to COVID. So there's a protocol for like prevention kind of thing. And then there's also a protocol, like if you end up in the hospital, here's something that you want to share with your doctors. So there's several different protocols, and they have a weekly session with updates about new research and new treatments and things of that nature that they have every single week. I believe it's on Wednesday evenings at 8:00 p.m. Eastern Standard Time. So I encourage you to go to that particular website, and if you can just Google FLCC Frontline COVID Critical Care, and that will come up. And like I said, there are lots of different protocols, as well as like a little sheet on like putting together your COVID kit kind of thing. So something to look into. And as you were saying, Dr. Sutton, yes, definitely doing a zinc protocol and looking at zinc, because I believe that zinc is probably the mineral that is most deficient in us as a nation, because we eat foods that are depleted of any nutritional value. And many people have difficulty upregulating the minerals. So things like your zinc and iron and things of that nature, because we have compromised digestive systems that don't have sufficient hydrochloric acid. Dr. Sutton?
I agree. And the other thing that up there with zinc that we're deficient in, and it applies to Weiliner, is magnesium. And I thought of it when first from the high blood pressure, but then from the spasm, because muscle spasms mean low magnesium.
Yeah.
And sometimes, often, we treat high blood pressure with diuretics, which make us lose more magnesium. And it could be a part of the neck pain. And we can soak up magnesium by mouth, but also through the skin. So it could be good to put some magnesium lotion or spray or gel on the neck before bed at night, just to see if you can wake up more comfortable in the morning. And make sure that you've really hydrated well, because we've got these little discs between our vertebrae. And if we're dehydrated, they're flat as pancakes, and we want them to be juicy and give some space for the nerves to come through without getting squeezed.
Yeah, that's very, very true. Many people, I would say the majority of people, are dehydrated. And it's compounded by the fact that a lot of people are consuming things like coffee and soda, which make you even more dehydrated. So every time you drink a cup of coffee or a cup of soda, you've gone in the toilet like 10 glasses of water, because that's about how much it's going to take to detoxify your body of that stuff and get yourself back on track. And you want to have those discs nice and fluffy, because it adds to the insulation and the shock absorption, you know, as well as making sure that you're not crunching and squishing the nerves. And with the oil, with the magnesium, Dr. Sutton, what I tell a lot of my clients to use is the magnesium oil, you know, and it comes in a spray bottle. And I even put in a little bit of essential oils in that and spray it. And you can use it as part of your nightly routine to massage it into your skin, because your skin soaks up whatever you put on it. You eat through your skin, literally. And that's why it's very important to think about whatever kind of personal care products you're consuming. And I'm using the word consuming because when you put it on your skin, your body is consuming it. And that can become extremely toxic and add to the burden that your body's utilizing your zinc to try and detoxify your system of, you know, the crud. So I'll definitely tell that person to do that zinc test along with the magnesium test, which I do with all of my clients because it's just such a critical mineral that's necessary for so many different functions.
If I could interject right now, well, ask
please do.
question.
Please do. Yes.
Yeah. The first thing is there a group of doctors from, I guess I get homeopathic and the holistic and everything mixed up, but from a health point of view, non-medication that we can use to, or that are available to treat people with mental illnesses? Because a lot of times, you just mentioned dehydration. A lot of times, some of these mental illnesses, because there's problems in the body and we could get a lot of the deficiencies handled, we could handle that cause of mental illness. The second part is I watched the Senate hearings on ivermectin. Why is this being attacked in the media as a drug that don't work? When I watched the Senate hearings and saw a doctor, I think his name was Corey or something like that, who actually stated before the Senate that if you take ivermectin, you will not get COVID. If that's true, and he said it before the Senate, how come we're not using it?
So you have two questions. And the first question, yes, there are lots of doctors and practitioners like myself that deal with mental illness from a purely non-medical standpoint. So I do that, and I'm part of a group called the Walsh Research Institute. So this is an institute that has piggybacked off of the research that was done initially by Dr. Carl Pfeiffer and other greats in the field. And what they do is have a very nutrition-based approach to dealing with mental illness. So that is definitely at your disposal. And if you'd like to get more information on that, you can also reach out to me privately. And in terms of ivermectin, well, I believe it just boils down to the fact that there are powers and principalities that put profits, politics, and power manipulation over the lives of people. And I think it's just as simple as that. And so, unfortunately, they have to keep the awareness of these life-saving medications out of the knowledge of most people, because that is the only way that they can justify pushing the vaccines the way that they're pushing them. You know, that was the only way that they were able to get the emergency use authorization, because it was based on the premise that there were no other medications out there to deal effectively with COVID. If that were not true, then they would not have been able to get the emergency use authorization, because that was a prerequisite. If there are other medical interventions that are viable, then you cannot get the emergency use authorization. But we're in this interesting world of politics and power manipulation and profits. So that's just my take on it. The rest of you guys can jump in.
Well, I thank you for being candid on it and telling the truth. You actually, what you said aligns with what I think. And most definitely somehow I'll be getting with you in the future. And there may be some things that can be done that help us on a national level. So we will talk on this in the future. Thank you so much for answering straight up with me.
And thank you for asking those questions. The area of mental health is very, very critical and important to me on a personal level, because 2 of my children were diagnosed with schizophrenia. And if I had gone the traditional route, they would still be strung out on all kinds of medications, and they would be the shell of the children that they are now. But because I was trained in the Walsh Research Institute and also with Dr. Amen, with the Amen Clinic, I knew that there were ways to help my children other than medications. And the research is in. None of these medications have very good outcomes in terms of long-term. Now, if you're in a crisis situation, yes, I truly believe that there are points in time when you must use medication to get people off of that cliff. I absolutely agree with that. But unfortunately, these medications are used long-term, and the damage that is created is tremendous, and people never come back. They never come back, really and truly.
Well, thank you so much. We will be in contact, and we'll talk at are you located in in California?
No, but I travel. I've been to California actually, and I've actually done workshops over there on children and autism and ADD and ADHD and that whole interesting alphabet soup spectrum. So I love traveling, and I love California.
All right, thanks.
Okay, an enzyme for digestion like amylase or proteins, fats, carbohydrates. So enzymes are a mixed bag. I'm going to put that to Dr. Sutton and Dr. Huante first. You guys want to jump in?
Amylase works on the carbohydrates, and protease works on the proteins, and lipase works on the fats. And if we do a good job chewing, then we take care of the carbohydrates in the mouth because our saliva has amylase in it. And chewing also helps break things apart so that when the food meets the enzymes in the stomach, it's easier for the liquids down there to get contact with all the surface of the foods. We make less enzymes the older we get and the less nourished we are. So I'm interested to hear what Michelle has to talk about both sides of enzymes. I think of them as wonderful generally, but I don't prescribe them for everybody because I don't want to take over for the body if we don't have to. My first step usually would be to give bitters because that's like a cheerleader for the pancreas to make its own juices. And if a person's really, really depleted, then I think we have to use enzymes because it's a rescue operation to give enzymes to get thorough digestion so the body gets the building blocks to build itself. It might just be too depleted to make enough enzymes for a while. But maybe it can just be on the enzymes for a short time.
And as you were saying, Dr. Sutton, it's really about figuring out where you are. And one of the things that we do is looking at the symptomology profile to see if there is evidence of the pancreas being overworked. If the pancreas looks like it's been depleted, then you've got to put in that emergency scaffolding. Exactly. But the first thing is to chew, 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 chew. Most people, they chew twice and they swallow like a boa constrictor, and that is, you cannot replace the chewing, the physical, mechanical chewing and the mixing of the food with the amylase and everything in the mouth. And then the other thing that many people don't realize is that if you are stressed out, you are going to create a situation where it is very difficult for your body to properly break down your foods, because when you are caught up in that moment of stress, then you're not able to digest. So either you're in the fight or flight, which is the sympathetic nervous system kicks in, or you're in digest and rest. You can't be in both, So when we go back to the ancient practice of saying your prayer, saying your grace before your meals, It wasn't just because, oh, mama told you to do it. It was because as you were being mindful and as you were being grateful, you were shifting, you were calming down the system and shifting into that parasympathetic to enable you to break down your foods more efficiently. And then the other thing to consider is that we live in a world where we're consuming a significant amount of cooked foods. And anytime you're consuming cooked foods, you're putting extra stress on the body to create the enzymes, because cooked foods do not have any enzymes in them. If you're eating raw foods, then they have their own enzymes. They're that wonderful combination packet, they come with their own enzymes. But as soon as you start cooking your food, you start depleting them of the enzymes. And therefore, there's more pressure on your system to create those enzymes. And as Dr. Sutton says, as we get older, our reserve becomes depleted, especially if you have been someone who has eaten a significant amount of cooked foods and very little raw foods. So depending on where you are in that spectrum, there are degrees of support. You don't automatically jump in and, throw everything at it. You start off small, at least I believe in starting off small, and then you start to build if you find that you're not getting enough support. But start by chewing, start by eating more raw foods and juicing and things of that nature, because that helps to cleanse the body and it helps to add the enzymes. Start with Swedish bitters, like Dr. Sutton was saying. That helps to activate the production of the various enzymes in the body and help with the breaking down of the food. So start small, and then if those things don't work, you can also put in a comprehensive type of food enzyme. And then for certain people, they have difficulty breaking down specific things. So there are certain people who have difficulty breaking down fats. There are certain people who have difficulty breaking down proteins. There are certain people who have difficulty breaking down carbohydrates. And for those people, we put in specific food enzymes to help to address that specific issue, because a generic food enzyme is not going to be particularly beneficial to those type of people. So it helps to know who you are on that spectrum and what your specific situation is. Wow, oh my goodness. We have had a full night, ladies and gents. I want to thank Dr. Sutton and Dr. Huante for joining us and being here with us, because as you can see, your words are full of wisdom and have been beneficial to so many people. And we are constantly getting questions that are coming in. And those are the questions that we love, love, love. And we geek out on doing research, So please, please, please feel free to send us questions so that we can do our homework and come here prepared to share more and serve you better. And without any further ado, I wish you a wonderful evening, and may you have peace and prosperity and be truly blessed as God grants you phenomenal health. And remember, health is not just physical, it's mental, emotional, spiritual. And when we come together, we are building immunity by creating community. Thank you so much, everyone, and have a blessed evening.
Yes, thank you.
Thank you all.
Dr. Huante.
Good night.
Good night.
Bye.